Interventions with a King. Discussion and commentary based on articles from JACC, Cardiovascular Interventions.
I'm Spencer King from JACC Cardiovascular Interventions. Happy to chat with you. I'm visiting today with Dr. John Byrne, who is chairman of cardiac surgery at Vanderbilt, and also has been intimately involved in the whole question of hybrid procedures. John, thanks for the wonderful article you wrote on the state of the art of hybrid technology and the editorial you've recently done on the paper with carotid and coronary hybrid procedures. The question I want to address with you is, cardiologists are very interested, as are surgeons, in how to work together, but where are we going with this hybrid business? How can it help us, and what unmet needs will hybrid give to our work?
Sure, Spencer. Thank you for including me. I think, as surgeons embrace more minimally invasive procedures, and as interventionalists become rightly better at catheter-based procedures, we're going to meet in the middle. And so the hybrid cath lab OR is really just the embodiment of that. It's the embodiment of bringing the best of the cath lab and the best of the surgery together to meet the needs of an increasingly complex patient population.
I know you've been taking a leadership role in this with this meeting you've recently had at Heart House involving education of cardiologists and surgeons together, and I welcome that. I think I wrote a piece called implying that surgeons were also interventionalists, which yes. you intervene a lot. In working at these kind of procedures, some of the questions come up. Well, isn't this cumbersome? I mean, how do you organize it? Can you? Is there? Do you step on each other's turf? Can you put it together? You've done that at Vanderbilt. You've put together a hybrid kind of room where you work with the cardiologist. How do you do that?
Well, it takes a lot of work. It takes a lot of effort to make sure that all the moving parts move properly at the right time. It takes ultimately it takes leadership. It takes the chief of cardiology, the chief of the cath lab, and the chief of cardiac surgery all singing from the same book, if you will. And it takes a concerted effort of the team to make these procedures successful. And we'll hit roadblocks, as we did. And I think we've seen all the pitfalls, and we've pretty much smoothed them out by now. But the paper we recently published in JACC, in our first 18 months experience in the hybrid lab, all comers, I think there were some 300 patients that underwent surgery or intervention in this lab. It's published in that paper.
Yeah, can you maintain the same quality of angiographic work and so forth in the operating room as you can in the regular cath lab?
Absolutely, yes. It is a cath lab.
Yeah.
The hybrid OR is a cath lab. It's also an operating room. So you can do
from sterility, how do you maintain that?
Very, very important question. Yeah, you have to have a lot of discipline, team discipline, to make sure that there's sterility is maintained. Absolutely. We have to external wound infection and other wound infections are a very, very important part of it.
There are a host of hybrid procedures we don't have time to go into here, but tell me some of the ways that you've used it.
Probably the most use has been with minimally invasive valve surgery with stents to non-LED vessels. That's probably one of our biggest sets of patients. And the others, of course, there's a whole group of patients with routine coronary bypass surgery with intraoperative completion angiography, which is a whole other matter.
Sure.
So every patient who gets a regular coronary bypass is imaged at the end of surgery to confirm graft quality. A
different kind of hybrid that you wrote the editorial about was carotid and coronary, where you'd actually combine those two things.
Yeah.
That was not done at the same time, the same day. I guess we're talking about hybrid, both simultaneous work as well as sequential work. What are the advantages?
Yeah, the hybrid lab that we have enables simultaneous, same one-stop shopping, if you will. All the procedures done in one operative suite at one time. Hybrid procedure has been done for decades, perhaps, since the first intervention was followed later by surgery. In the modern era, hybrid procedures refer to a condensation of the timing. So it's, same day, for example, that paper by Veracci, they did the stents of the carotid in the morning, followed by surgery in the afternoon. What we would do, if we would do stents at 7 a.m. and surgery at 7:30 a.m.
I see. Well, one of the things that I think are most interesting about this, and congratulate you for really stimulating this area, is the conversation between the surgeons and the cardiologist about the best way to accomplish things rather than going different directions. So it's been great visiting with you, and we look forward to a lot more of your work in that collaborative educational process between the cardiologists and the surgeons.
Well, thank you, Spencer. That's it. That's the key thing is building an environment, a working relationship where cardiology and cardiac surgery are working shoulder to shoulder for the best possible outcome for the patient.
Well, John, thanks for having that conversation with us. We look forward to seeing you again on Jack Cardiovascular Intervention.